Hi everyone, this is Dr. Story with a few updates for you. This is week 3. You've made it halfway through. You see the big T on my shirt. I'm a University of Tennessee Knoxville alumni, and I'm in Tennessee right now. Speaking of which, after this class, I will no longer be a member of the faculty at University of Tennessee Knoxville. I will put up my new emails in case you all would like to keep in touch, talk about health disparities, or any other things. Just a few updates for this week. I won't be on here very long. Um, I wanted to mention great conversation about isolation in terms of immigrant health and also rural health. Again, feel free. I'm going to be continuing to really examine your discussion boards as I grade them. So, really feel free to ask your peers questions and to engage in deep conversations with them on the discussion board as you're able to. I'm really enjoying what you all have put up so far. Also, be sure that your discussion posts are based on the readings, of course, and the materials for the week. I wanted to mention for some of you who mentioned linguistic and language standards, if you work in the hospitals, which some of you do, I wanted to mention the CLAS standards, CLAS. I put the link on the discussion board. If you go to the Office of Minority Health, you will see that CLAS standards. These are national standards that clinical people are supposed to be following in regards to cultural competency and linguistic competency. I've worked in hospitals for a long time, and I know how sad it is when children have to interpret for parents or when subpar interpreters are used to explain really important medical procedures to patients, which could end up providing really detrimental results. This week, I had you look at some stats on rural health. Some of you already knew those things. Others of you may be new for you, but rural health is a really important area of health. And when we talk about rurality, that is part of culture as well. Some of you all may be from smaller towns. I've worked in smaller towns. There's a different lifestyle and standards sometimes in smaller towns, and different health choices are sometimes made in smaller towns. Not to be judgmental or good or bad, but they just are, right? But some of those choices do lead to some poor health outcomes, unfortunately. Last thing I really want to spend some time discussing with you is the cultural health profile. Again, the groups you can speak to or interview or take pictures of artifacts. Again, please don't take photos of people, especially without their permission. You can go to a cultural festival. You can go to a religious service for a religion that you are not a part of. You could also go to a senior citizen home. You'll see a little bit later next week. We have an article on CBPR and the elderly. The elderly is considered a cultural group. You also could interview or go into a community that is impoverished. There's a lot of literature on the culture of poverty. People living in poverty have, as we know, different concerns and different circumstances from some of us who are definitely not impoverished. So these are just some ideas. If you have any questions, concerns, or problems regarding your cultural health profile, please send me an email. I will respond to you as soon as possible. I hope you're already working on that as it is due next week. It's our last week of class, and the profile is worth 100 points. Speaking of the profile, you'll want to follow the directions on the syllabus to a T. The third part on the syllabus refers to a post-reflection paper. Within that part, you really need to sit back and think about your project and how all of the readings from the semester or particular related readings or videos relate to what you have seen doing your cultural health profile. Points will definitely be removed if you don't relate what you've done in your cultural health profile back to some element from the readings and course materials in class. I'm sitting here looking at the syllabus to also highlight a few things you may have questions about within the cultural health profile. Your introduction and pre-reflection paper, be sure to pull some statistics. I've made some suggestions. Could be the Centers for Disease Control and Prevention, National Center for Health Statistics. Just give me a little bit of an introduction. I'm on page 3 of your syllabus, by the way, under the cultural health profile. So the outline for the report, number 1, introduction and pre-reflection. Follow the directions there and you'll be fine. Make sure you adhere to the last sentence under number 1 on page 3 under cultural health profile. Let me know, does the information from your interviewee align with information found in your references? Also, when we talk about an interview, if you decide to go to a senior home, you could interview a person who is over that facility. If you go to a different religious service, if you go to a mosque or a church or a synagogue, and there are, I know there's a synagogue, I believe, in Stillwater. So if you went to those, you could arrange to speak to the rabbi or the religious leader briefly before service, or maybe even over the phone, to conduct your interview to learn about the culture of that organization. Of course, culture includes sexual orientation. That is part of your readings for this course as well. There is a center in Tulsa regarding LGBT issues that you could consider visiting as well, depending on where you live. Back to number 1, making sure the information from your interviewee aligns with information found in your references. For example, your interviewee may say, we have high rates of smoking among our parishioners. And let's say the congregation is in Perry, Oklahoma. Well, that does line up with the references you've already read about on rural health, that smoking is an issue in rural populations. So that's one example. Same thing with STIs and maybe some specific LGBT populations depending on the location. So I'm still on page 3 at the bottom, pre-reflection paper. This is simple, describing your cultural awareness of the group prior to doing the paper. You may have had a good amount of cultural awareness, but just not been exposed to that community or culture. Or maybe you had very little, and that's why you selected that particular culture. Page 4 on the top is very self-explanatory. Be sure to adhere to all of those questions. With each picture, what do we see here? What is happening? Why does this strength or concern exist? Your profile or pictures don't have to be just about disparities, inequities, or things that, quote, aren't right. They can be things that are very strong about communities and culture. So please be sure to include those, because we're on a journey to health equity. And in order to do that, we need to be able to look at the strengths of all cultures and how those can be used to better the health environment and to promote health equity. Number 3 on page 4, ending the description of the cultural health profile. Be sure to summarize your findings. Be sure to adhere to the page limits that I've placed on the syllabus for you. And again, I reiterate, meaning it's really important, the very end of number 3 on page 1 under cultural health profile. Be sure to relate your cultural health profile back to the readings or course materials that are relevant to your cultural health profile. If you're picking a group, and maybe we didn't go over that, because of the vast information I've included in this course, I'm sure there's still some information you can utilize, even if it's simply on the definitions of health and equity, disparities, and how that relates to your cultural group and to the profile. Also, following the syllabus, be sure to post your reflections on the discussion board on July 6th, and make sure you take the time and interact with your peers to find out what they've learned about their culture, and hopefully that'll help you learn some more things as well. That is the end of my updates. This will probably be my last video update for our 4-week term, unless I come across something else next week that seems like it needs a response on behalf of everyone. I hope you're having a great summer. And again, feel free to contact me at any time with any questions you have via email. I should be able to respond to you within a day and no more than 2 days at the most. Last but not least, your reflection papers. I'm grading those on Fridays. I'm going to start to grade them tomorrow. So those grades will be posted for you as soon as possible. Again, if you have any concerns, just let me know. Also, if there are other things that you would like for us to discuss in the next week, or even a question you'd like for me to post on the board for everyone, I would definitely do that. On the discussion board, I've responded to a few of you. I would love to hear back from you as well to continue our dialogue. So take care and have a great week and holiday weekend. Bye-bye.